A very good evening all. I'm Diti Lamba with the Thursday night edition of South Asian News. Welcome to Vision of Asia, Voice of Our Community. We are coming to you from our studio in New York City. Here's what's happening tonight in the coronavirus pandemic. Nearly 1.2 million deaths from the novel virus globally tonight, with more than 44.6 million cases in the world. Europe is coming closer to the brink as several countries report new daily COVID-19 cases, and countries such as France and Germany have announced new restrictions, a nationwide lockdown to contain the spread of the disease. Here in the United States, we are looking at nearly 8.9 million cases of COVID-19 with more than 228,000 deaths. Quite a sobering number. We send our condolences to all the families that are grieving the loss of a loved one. Daily U.S. coronavirus hospitalizations surpassed 45,000 for the first time since mid-August as this autumn surge of cases continues. In cases, the U.S. is reporting a record high 7-day average of more than 74,000 new COVID-19 cases per day. Experts say that it's likely to get worse as the season continues. The Midwest is seeing a record number of cases and spiking rates of hospitalizations. State of Indiana reported its peak levels of coronavirus hospitalization, while Wisconsin is on a track to run out of ICU beds and nurses to staff them in less than 2 weeks. In Tennessee, hospitalizations are rising at an alarming rate right now, with records set every day. State of Illinois is getting closer to the entire state implementing mitigation measures. On vaccine, the Food and Drug Administration has yet to approve any of the multiple candidates undergoing the trials. Meanwhile, India, motherland to many of South Asian Americans, has surpassed 8 million cases of COVID-19 and is moving closer to surpassing the US in total number of infections. And we are only 5 days away from the November 3rd presidential elections, with more than 75 million Americans already voted in this election. So remember, it's important to make your voice count, your identity seen and respected by casting a vote for the future of this country. Again, please go on iwillvote.com or vote.org for more information. With that, it's now time to start the South Asian News segment for tonight. Here are the headlines. Dr. Purvi Parikh addresses coronavirus pandemic updates and measures in New York City. Punjabi Chamber of Commerce hosts virtual panel discussion on An Entrepreneur's Guide to Cybersecurity. Bihar Jharkhand Association of North America and Consulate Journal of India host Bihar Business Tourism Conclave 2020 New Jersey. It's time for a short break. Stay with us in Vision of Asia, Voice of the Community. We'll be back shortly. And welcome back. I'm Aditi Lama and this is Vision of Asia, Thursday night episode of South Asian News. Looking at the coronavirus updates and measures, today the White House Coronavirus Task Force is warning of a persistent and broad spread of COVID-19 in western half of the United States, and its members urge aggressive mitigation measures to curb the infections. Meanwhile, nation's health expert and director of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci, has said that we are on a very difficult trajectory and noted that COVID-19 cases are rising in 47 states and patients are overwhelming hospitals across the country. This White House Coronavirus Task Force has also warned states in the middle and west of the country that aggressive mitigation measures have to be taken. This is occurring due to increased indoor gatherings in this cooler weather. Meanwhile, on the vaccine front, Pfizer has said that its experimental vaccine will be the first available in the nation in mid to late November, followed by Moderna Inc. So how should we analyze the current situation of COVID-19 surging nationwide, and are South Asians at high risk of coronavirus? We spoke with expert Dr. Purvi Parikh. Urging all to wear a mask and practice social distancing, here is Dr. Purvi Parikh. You know, Dr. Parikh, nationwide hospitals are getting overwhelmed again. The healthcare system is getting overwhelmed again. What is needed from the government right now, according to you?
Right. So, again, some mandates for public health measures. The masks are one thing, but then other than that, they might need to, again, mandate those gatherings that occur. If we want to avoid the large scale lockdowns or shutdowns of businesses, we have to at least limit what people do personally, during their free time. So these are all things that we need to take into account. Also, rapid testing as well as contact tracing is important, because if you're able to identify someone who's positive and everyone they've come in contact with and isolate them, then you can quickly stop that spread quickly. So hopefully those measures will be helpful. And we're looking to see that hopefully a good, reliable vaccine is approved. Right. And don't forget, it's also flu season, and already our hospitals get overwhelmed every year, even when it's not a pandemic. So we are all strongly encouraging everybody to get their flu shots, and the government should also encourage that as well.
Have you seen any interactions between the seasonal flu and COVID-19?
Well, not interactions in the sense that of the two viruses interacting, but we're already seeing flu cases in New York and some of the Midwestern states. So, we don't want our health systems to become overwhelmed and that our ICUs don't have room for COVID-19 patients because it's full of flu or vice versa. So they do have a potential to cause what they call a twindemic. And if we have two pandemics going on at the same time, it's going to be much worse than what we even saw in March and April, because the hospitals will become even more overwhelmed. So again, we're encouraging people to get vaccinated. The masks, hand washing, social distancing, it helps for all spread of all viruses, so hopefully we'll be able to reduce both flu and COVID-19. One piece of good news is that places like South America that were in lockdown during their winter, and Australia, they actually had less flu cases than in previous years because people were so strict about COVID-19. So I'm hoping that maybe we'll also get a milder flu season if people take things seriously.
Yes, for sure. And it's so important to get your flu shot. I, again, want to reach out to all of our audience here while you are there with us to get your flu shot. It is so important. Just discussing a little bit more on these overwhelmed hospitals. Do we have enough PPE supply for doctors in case there's a second surge, especially in the Northeast? Are there enough beds? Are there enough ventilators? What's your take on it?
Right. So, the idea right now is that we don't want to end up in a situation like we were before. And I'm hoping that these officials are learning from the mistakes to make sure that there's enough PPE in stock, that there's at least 30% capacity in all the hospitals. I know those are kind of the regulations that New York has in place, so that as soon as we start, running low on that, things start shutting down and more, strict mandates are placed. But that being said, unfortunately, I am getting reports from across the country that there still is not adequate PPE, and I'm not quite sure what the reason is. Before this pandemic started, like N95 masks, all masks, we would dispose of them after one single use, and that's how they're meant to be. But I'm still getting reports of healthcare workers needing to reuse these for days at a time. So that tells me the PPE problem is still not solved. Because why are we reusing disposable products?
Yes, for sure. And I think the government has a lot to do with this. They have to really, have us get all of this PPE supply. And I know a lot of other organizations were helping too, but I think it has to come from the government. I want to talk to you about these vaccines and therapeutics. Today, Eli Lilly made a deal with the US to supply 1 million doses of the monoclonal antibody. We have heard about it since President Donald Trump's COVID-19 diagnosis, and that's where he was given something similar to that. Could you describe to us what's happening in this monoclonal antibody, and is it really a good therapeutic for COVID-19?
Right. So, it's being studied because, as we know, with COVID-19, people present completely differently. One person can have very mild symptoms. One person can pass away. Some can have, strokes, neurological problems. So it's very, very different person to person. So it's good that we have multiple therapeutics being approved, because something that might work for me might not work for another person. Right. So the way these monoclonal antibodies work, Eli Lilly has one as well as Regeneron, and the president received Regenerons, is that they bind to the virus in your blood, and so that they lower the amount of virus circulating in your blood. And the idea is that by doing that, it makes you get better faster because there's less of the viral load. The good news is that they're trying to get these antibodies approved for outpatient use, meaning if someone gets sick, and they can get a shot of these monoclonal antibodies, and maybe that will prevent them from needing to end up in the hospital. So because we're focusing a lot on prevention right now. So that's a great therapeutic if we do see that it's safe and it works well, because we can actually give it to people outside the hospital to prevent the hospitals from getting strained or overwhelmed. So I think that's very exciting. And I'm hoping also that, there is at least a vaccine approved before the end of the year. I know it will take time for everyone to get it, but that's another thing. So prevention, I think, is key and should be the focus for a lot of these therapeutics.
The Punjabi Chamber of Commerce functions as a non-profit aimed at uniting the global Punjabi business community comprising of business owners, professionals, students, and many more. The Chamber helps its members by offering informative programs, creating new connections, and locating new opportunities to further the growth of the Punjabi community in the nation. Recently, the Punjabi Chamber of Commerce hosted a virtual panel discussion titled An Entrepreneur's Guide to Cybersecurity at Work and Home. The panel discussion provided valuable insight on the current cybersecurity threat landscape and trends, while also provided guidance on how business owners, professionals, and students are able to safeguard themselves from coronavirus-themed attack with a layered approach. Visit punjabichamber.com for more information. Here is what the panelists shared on cybersecurity.
There's mounting evidence that shows that small to medium businesses are more vulnerable now than ever, and they're being targeted more. Complacency regarding this reality can have disastrous consequences. And at the end of the day, the risk is real. And the data, if an organization faces a data breach, a small to medium business, they can lose everything as a consequence. So today we wanted to discuss a little bit about some of the things that business owners can do to improve their cyber posture, both at home and in their businesses. So when we think about starting a new business, we think about hiring and engaging people for legal counsel. Maybe we hire an accountant. We put some money aside for marketing, technology, maybe a CRM platform. But we really don't think about hiring resources that are solely responsible for baking cybersecurity into the culture of an organization. Oftentimes, and usually out of financial necessity, business owners have to wear multiple hats. And the one hat they usually forget to wear is a CISO, the Chief Information Security Officer, and probably for the obvious reason. Building out a cybersecurity program can seem like a daunting or insurmountable task for somebody who has little to no experience. So I'd like to start with Krista, and maybe you can share with us some ideas on what someone can do if they're responsible for their own organization's information security. Where do they start?
The identity and authentication policies that you have, how you're authenticating to any platform or program, to your account. Is it just a password? What are those password policies? And then additionally, we really encourage having multi-factor authentication enabled for every account. If you want me to explain what that is, I can do that as well. I'm sure. So multi-factor authentication, it's also called two-factor authentication. What this is a combination of at least 2 of 3 factors. These 3 factors are something you know, which is very often password, something you have, which might be a code sent to your phone via SMS text or through an authentication app, or something that you are, which would be like a biometric, like a fingerprint. The reason why we stress having 2-factor or multi-factor enabled is because passwords get exposed all the time. There's data breaches that expose passwords. You might be using a weak password that could be easily guessed. So there's a chance that a cyber threat actor might have those passwords. If they try to access your account through that with that password, what'll happen is that it'll be accepted, but then they'll be prompted for that second factor. So unless they have that second factor, have your phone or have your fingerprint, they should not be able to gain access to your account. It's one of the best things, if not the best thing to implement to reduce or eliminate your risk of account compromise through credential theft, so through password theft. So that's why I stress it so much. It's because it's a pretty easy thing to implement, and it significantly reduces risk. There's a number of things you can do with somebody's account when you gain access to it, a number of different cyber threat avenues to go down. So securing those accounts is really paramount, particularly for network access. In addition to that, inventory. So to bring it back to the business term, know what systems are out there in your network. What systems are connected to your network. Do a network map if you can, and just start from there. What systems do you have? What do you need to protect to begin with?
Absolutely. Harvey, would you like to weigh in on where to start?
Sure. I mean, there's a couple of things. A couple of the ones which Christina's nicely touched on, absolutely fine. Only thing I would add is these are services naturally which you're going to be paying for. So you need to go out and make a consumer choice just like you would with anything else. A lot of people normally come to me and say, oh, my data is safe. I'm using Amazon AWS. What does that actually mean? People sometimes assume Amazon AWS is they've got the servers directly with Amazon. They're not looking at, they could be via third parties, etc. And who's actually their supplier? What type of accreditations do they have? Are they ISO 2001 accredited, etc.? Really look into the suppliers a little bit more. And then working from home, that's a big thing right now. Everyone across the globe is doing this. And when you're going to be accessing your work, you're using your home broadband. When is the last time anyone listening into our chat today changed their password at home? How often do they change it? How many people's kids know their passwords for their broadband at home, etc. And then if you're using the same connections to access your work accounts, you're not necessarily going into a secure connection. You could be loading up your Office 365 using your web browser from your home broadband and simply going into work spreadsheets, etc., which all contain personal data.
I think you bring up some really great points. And Vikas, I'm going to go to you because some of these things we're talking about in a business environment, but I know on some of my social media accounts, two-factor is an option, right? So let's talk about some of these things as it pertains to working from home or your own personal accounts.
There's some really clever stuff here, and I'm not that clever, so I like to kind of bring it down a couple of notches, just so that I try and explain stuff to my mum, and I try and explain stuff to my mother-in-law. If I can do that, then everyone will get it. So with a lot of these security protocols, we've seen two-factor authentication, we've heard about passwords, let's start with the absolute basics. The basics come down to what is it that you don't want someone else to have access to. So everyone on this call is likely to be an entrepreneur, has a business. There's going to be some information that is critical to your business. That could be your business plans, it could be your accounts, it could be your customer records list. I always say start with a list on a piece of paper of where this information lives, right? And draw rings around it. And draw like, is it physically in my hand? Is it on my phone? Or is it in the cloud, right? Like, so where is this information? And then while there's always you get what you pay for, a lot of the service providers, whether you're a Mac user or a PC user or an iPhone user or Android or whatever type of systems you use, a lot of these manufacturers have now baked in common security practices like 2FA, multi-factor, for free. So these are two great starting points that you've paid absolutely no money for. And we're a bunch of Indians on this call, and I'm an entrepreneur as well. We don't like paying for stuff. We like free stuff. Free is write a list. Free is enable security settings on the devices that you already have.
It's time for another short break on Vision of Asia, Voice of the Community. We'll be back shortly. Welcome back. This is Vision of Asia, the South Asian news segment, and I am Aditi Lamba. The Bihar-Jharkhand Association of North America aims to carry out, promote, and coordinate philanthropic, educational, and volunteer activities and efforts. The association passionately also serves physically and economically disadvantaged communities in the Indian states of Bihar and Jharkhand. The association also prides itself in hosting numerous events and celebrations to engage more members of the Bihar-Jharkhand community into the greater diaspora of South Asians, while also providing a platform for the younger South Asian generation to understand and relate to their culture, heritage, and people. On that, abiding all social distancing and mask-wearing measures, the association, in partnership with the Consulate General of India, New York, recently held its Bihar Business Tourism Conclave 2020, addressing tourism and business opportunities for Indian Americans. Here's what community leaders and key members shared with us on ITV Gold, including Indian Consul General of New York, Mr. Randhir Jaiswal. Visit BJANA.org for more information on the Bihar-Jharkhand Association of North America. Here is the story.
Yes, I am an expert on tourism and host a PBS travel TV show, also on Amazon Prime, and I'm excited to be here today to learn more about Bihar and share some of my insights from traveling all around the world and working with tourism boards to promote travel and tourism and the industry in general. So it'll be great to network here, see some art and paintings, and also some great Indian cuisine here in New Jersey.
I am Dr. Avinash Gupta, President of BJANA, and BJANA is proud to host this BJANA Business Conclave to promote tourism and business in Bihar. In last 15 years, the roads, electricity, law and order, everything has improved, and there should be no hesitation in people going and visiting those great, wonderful, historic places and invest in Bihar. Yeah, we thank Dr. Purvi Parikh and ITV and his Parikh worldwide media in promoting the business and tourism, and FIA has done a lot of philanthropic activities during COVID, and he has been every step of the way he has supported us. Thank you.
Hi, this is Nupur Nishit, and we are at the Bihar Business and Tourism Conclave. And today I'm going to speak about the beautiful art and culture and traditions of the state of Bihar in India. And it's like Bihar has a very long and very beautiful ancient heritage, which they have carried it today itself, and there's lots of traditional aspects to it. And and thank you so much.
Good afternoon. We are here to celebrate with BJANA what the diaspora can do for Bihar and Jharkhand. In our engagement, in our international engagement today, we want to promote engagement with states, and for that reason it is important that we connect with organizations like BJANA and other organizations to promote India. So we had a fruitful session here promoting business and tourism. I look forward to your engagement in Bihar, and please do visit Bihar. Thank you.
Today, in addition, we have gathered for the Bihar Business and Tourism Conclave. It has been a great meeting with a lot of discussions with representatives of government of Bihar as well as business leaders from Bihar. The diaspora, the Indian American diaspora here in New Jersey is willing to invest in Bihar, and there is a lot of interest also about promoting tourism in Bihar. So we look forward to, Consul General of India looks forward to supporting and helping in all this initiative to promote the state of Bihar.
Hello, namaste, good afternoon. My name is Alok Kumar. I am the former president of Federation of Indian Association and the executive member of the Bihar Jharkhand Association of North America. Today, it was a great day for us, for all of us. I am from Darbhanga, Bihar. I am very proud to my heritage, my culture, my custom. At the same time, when you feel proud for something, you want to promote that. And today was the day when we started promoting Bihar Business and Tourism Conclave. We had the esteemed guest, Consul General of India, New York, Sri Randhir Jaiswal ji, celebrity, producer, writer, host at PBS, Darlie Newman, Nupur Nishit, artist, and all the community leaders here from the Bihar.
We now have a community shout out for the Sant Nirankari Mission New York. The non-profit organization is hosting a Humanness blood drive at 712 The Plain Road, Westbury, New York. This blood donation drive is being held in collaboration with the New York Blood Center. Visit nirankari.org/New York for more information. And this wraps up our show for the night. Remember, there are only 5 days left till the elections. Please send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. You can also subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from Queens, New York. This is Vision of Asia. I am Aditi Lamba. Please go and vote.